Hi everyone. So in this PowerPoint, I'm going to be talking about the spine. So the spine is a very complex region of the body. It's literally the backbone of your body. Obviously, this is your bad joke of the day. Provides on a lot of stability through usually the connection of the bones and the ligaments that connect those, and the muscles that pull in different segments of it. To really provide your body with that fundamental support. Okay, but also has to be able to provide movement and flexibility when need be. So it's very kind of complex in how it plays and all that. Excuse me. And then when something bad goes wrong, usually it's pretty extreme. Usually you have a hard time moving. You have pain that radiates everywhere. Especially along any of the nerve roots. People often call that a pinched nerve. All the nerves that come off the spine go in, innervate all your organs, muscles, all your sensory receptors, and all that. Okay, so it's a big part of that. Okay, so your thoracic spine has 7 sections. Okay, and then you have 12 thoracic vertebrae, and then 5 lumbar, and then 5 sacrum. Okay, and then 4 plus or minus coccyx bones. Okay, so the best way of remembering some of the numbers is, this is like a super old school kind of saying when people used to eat normal times of the day: breakfast 7 a.m., lunch noon, dinner 5. Okay, your sacrum, is fused. Okay, usually by adulthood. So usually you don't have all these different segments. Okay, and then your coccyx is kind of like 4 plus or minus fused vertebrae. Some people have 1 or less. You really don't see a factor in some of those. And now some of the anatomy of some of these. Okay, so all the pictures will get more in depth on some the different sections of the vertebrae. On all those, let me try and make my thing a little smaller that we can see. Okay. So the first one, is your transverse process. Okay, the site of attachment for muscles and ligaments, point of articulation to the ribs and the thoracic spine. Okay, so the transverse process is more out on the side here. Okay, 6 on both sides. I don't know why the picture is cut off a little bit. Okay, and just for your general landmarks. Okay, the spinous process sticks out here. Okay, that's the back. So when you bend over to see someone's back, you see the little ripples. Okay, you're looking at the spinous process. Okay, so that's the most posterior side. The body is on the more anterior side. Okay, so the spinous process kind of sticks out of the sides. Okay, and then your ribs articulate and they actually attach to the spinous process. Okay, and then you have a little synovial capsule that attaches the two. Okay, your facets, synovial joints. Okay, functions to guide and limit movement to the spinal cord motions. Okay, so your facets. Okay, so right here is your superior facet, and on the inferior side of this vertebrae, you have a inferior facet. Okay, and that's where they kind of interlock. Next, you have your vertebral foramen. Okay, this is the canal for your spinal cord. This is a big kind of hole right here. Okay, that's where your spinal cord goes through, and a few ligaments. Okay. The last one's going to be your spinous process, what I mentioned earlier. Okay, this is kind of that protruding area off the posterior side. And this is a good area of attachment of some muscles and ligaments, especially because it sticks out so far. The farther it sticks out, the usually more the longer the lever for that movement to occur. Okay, so on the cervical spine, excuse me. There are 7 cervical vertebrae. Okay. C1 and C2 are very unique. Okay, they're called the atlas and axis. Now, super old school, if you ever had a globe growing up, okay, the atlas, the atlas globe, okay, sits on the axis. Okay, so axis is this little thing that sticks up and the globe kind of rotates around it. Okay, so that's how it's kind of figured out. So this is C1 is up here at the atlas, and axis is C2. Okay, Now, I mean, it's a good picture, but it doesn't quite give you like the kind of gist of it. How this odontoid process, or the dens, this little area that sticks up right in here, okay, it sticks up, is actually part of C2 of the atlas. It sticks up, and that's kind of where most of that rotation occurs. Okay, and the atlas sits nice on this, and you have this transverse ligament that kind of sits and kind of keeps it in place. Okay, so if this ligament ever like snaps, okay, you would have this shifting between your C1 and C2, and that would can potentially sever your spinal cord. Okay, so usually when, like back in the day when you're being hung, and that quick like snap of the rope when like the floor drops off, usually snaps this transverse process, or sorry, transverse ligament, and usually results in that severing right there. Usually what kills you. That's kind of just besides around the hanging. Okay. Let me see. What are crazy things about this? Another thing about this kind of transverse ligament is individuals with Down syndrome usually have a weakened transverse ligament, and usually that's a result of, that's the rationale why individuals with Down syndrome can't do contact sports, because they're more prone to severing of that ligament right there. Okay, but a lot of rotation happens here. Just know that. You can really isolate your C1 and C2 movement. So if you do neck flexion all the way, and then with rotation, you'll see how far I get more motion, cervical rotation right, than I do left. Okay, and there's like muscles and issues with my neck because of that. But that's one way you can really kind of isolate and see the movement between C1 and C2, and you can kind of break it down from there, depending on whatever issues you have. Okay, more about the cervical spine anatomy, mainly C3 through C6. Okay, very small, kind of light, very wide vertebrae. Okay, that allows for more motion. Obviously, even more cervical motion than you do the kind of thoracic. Okay. Let me see. It also has these kind of transverse foramens. Okay, for kind of veins and nerves and arteries that travels through. Okay, and here on the sides. Transverse process sticks a little bit farther. You can see like the C1 sticks out really far. Okay, out in here. C3 is a little bit, doesn't stick out quite as far. Let me see. I think that's for most part the gist of cervical. All right, thoracic. Okay, so talking about thoracic here, a little bit better picture of it. Okay, so you can see on all these, the size of the cervical, and the thoracic is a little bigger, and then the lumbar are substantially larger. Okay, so there's 12 thoracic vertebrae. Then they increase in size as they get farther down. Okay, and you also notice the spinous process from the cervical to thoracic. Thoracic gets much larger. Okay, and it sticks down a lot farther and actually overlaps the vertebrae underneath it. Okay, kind of more as of a support, prevents that thoracic extension more, because some people don't have a lot of thoracic extension as a result of that spinous process kind of locking and making sure it doesn't. So it's like it's a really kind of bad example. So if my fingers are kind of interlocked, okay, that's kind of like spinous process sticking out. So as I extend back, it stops me from going back any farther. Okay. As a result of repeated back extensions, forced back extensions, usually the repeat stuff, you can actually have a lot of fractures that occur to the spinous process, especially right in here. Okay, some are most are painful, some are not, but that can't happen. I think, and you also see the vertebral foramen. Okay, how it's very large, where the why am I drawing a blank right now? Where the spinal column kind of travels through. Okay, is larger for the cervical. Thoracic is a little smaller, and it's roughly about the same size for the lumbar. Okay, lumbar, okay, is only 5 lumbar. Very thick, very heavy, because it has to support a lot of weight. That's why it usually gets bigger as it goes down. Transverse process is very, very long for a lot of leverage. Okay. There's less extension than flexion on some of these because the lumbar spine is already in this like lumbar curve. Okay. And so it doesn't want you to do a lot of the extension there, but it will allow you some flexion. Okay. Your sacrum and coccyx, excuse me. Okay. Okay, so 5 sacral vertebrae, fused together. Okay. So these are kind of fused in here, like there would be like a line right in here as they separate. Your ilium, or your hip bones, attach here on the side, okay, of your sacrum, okay. And then your coccyx, okay, which is about 3 to 4 small bones that makes up your tailbone, okay, can be dislocated or fractured, okay, if you land hard, weird ways. Usually relocations are kind of awkward and painful because they have to go in and realign it through the only hole back there, if you can imagine kind of what I'm saying. And then a lot of these holes here, these posterior sacral foramens, some nerves and arteries and veins travel through all these as it goes all the way down. All right, vertebral discs. Okay, so your vertebral disc is kind of like in between all your vertebrae. Okay, and they are made up of a fibrocartilage. Okay, kind of a disc. You have your annulus fibrosus. Okay, this kind of really thick exterior cartilage that travels inside. And inside you have your nucleus pulposus. Okay, so this is your shock absorber for your body. Okay, and usually takes a good amount of force. It does a really good job. It allows you to do all your flexion, extension, rotations, side bends, all that. Usually, as you get older, they tend to wear down due to just loss of blood flow, low nutrients, kind of like low water content to some of these, just a result of aging. They can bulge, and the nucleus pulposus can like bulge out of that kind of annulus fibrosus and kind of impede some of these nerve roots. Let me see if I have a better picture. All right, so your discs, okay, are going to be right kind of in between here, okay, and then in between like this little like hole right here. That's where your nerve root comes out. So all your spinal cords, okay, your spinal cord little segments kind of come out. Okay, so every little segment right here, nerves come out, little ones. Okay, so everyone thinks they have a slip disc. Usually some kind of bulging of that nucleus pulposus, okay, through the side, okay, which gets in the way of that nerve root. Okay, so it's usually some kind of nerve root impingement. Okay, so that if that nerve gets impinged, it can cause pain, loss of sensation, a lot of those things. Now, a lot of people have some kind of hemorrhage of their discs. I think it's like 80% people have them, but like 75% of them are asymptomatics, which means you have no symptoms. And there is some rehab strategies to kind of get that nucleus pulposus to kind of suck back in to a more stable state. That's a really, really advanced kind of subject to talk about. Okay, but most people think, oh, they have like some kind of nerve impingement. Some just have like tight muscles in their low back, which can not really give you that same sensation of that like nerve entrapment. But more just kind of that general kind of pain. Okay. Oh, here's a good picture of your disc right in here. How it sits in between. All right, so ligaments. Okay, you have a lot of ligaments in your back. Okay. First we'll talk about is the anterior longitudinal. Okay, so that one is right up in here, kind of in the front of your spine. Okay. Wide and long, spans the entire anterior surface of your spine. Kind of restricts your extension. Okay, if you just kind of picture where it's at, Okay, so it's anterior, so it restricts that extension to a certain extent. Okay. Next, you have your posterior longitudinal. Okay, and that one is kind of hard to see. So it's right here. So it's kind of deep in there. Okay, so it's like within the vertebral canal. Okay, so it extends the full length of the posterior aspect of the bodies, and that one limits your flexion. Okay, because all the movement's going to occur kind of around like the base or the body of your vertebrae. Okay, so just because that's on the posterior side, that's going to limit your flexion. Next is we have your supraspinous. Okay, so it attaches to each spinous process and limits flexion. Okay, so that one is right in here. Okay, so that one is right on like on the edge of your spinous process that sticks out. Excuse me. So when you're palpating someone's spine, you can kind of feel like the little like bumps of each spinous process. Okay, it goes up, it comes down, comes up, comes down. So if they have a sprain, usually to their kind of supraspinous ligament, usually you're going to feel it kind of come up, and this is going to go straight across and go back down. It's not going to be like a really, really intense inflammation, just because ligaments don't have a lot of blood flow, so it doesn't get inflamed as easily. But instead of feeling that kind of like the bumps, when it gets inflamed, it goes just kind of straight across. Okay, and it takes a long time if you're actually getting into palpations to kind of know kind of what you're feeling with this. Okay, and the last one is going to be your intraspinous. Okay, so this lies between the spinous process and limits rotation and flexion of the spine. Okay, so this is right up in here. Okay, so all these ligaments provide a lot of stability, okay, for your spine, and they're very, very important. And a lot of people rely on the ligaments a lot, especially when they lift things, especially when you lift them improperly. So your ligaments are your primary structures of support. Okay, they're very passive support because you don't have to actively think about using them. To where your secondary kind of support is going to be your muscles. Okay, so your muscles are very, very important, but it relies on you to actively engage them. Okay, so you have to like usually mentally or subconsciously engage them for them to be stable. So a lot of people, when they say lift with your legs, not your back, it's because when you lift with like a rounded back, what happens is you're relying on just your ligaments for that support. Okay, and depending on how much you're lifting and the body weight the ligaments have to support already, they could give way. So that's why relying on your muscles is a better means of support. Okay, that's why it's really, really important during lifting. The downside of this, which usually is the biggest culprit, is a lot of people don't want to waste energy to engage their back, okay, to lift properly. Okay, so they don't want to rely on it because it's exhausting, okay, especially if you don't really exercise or train your back much. Okay. Muscle of the spine, there's a lot, obviously. Really, really important for stability, okay, as I mentioned before. Okay, I'm not going to go through all of these. Just know that this is probably majority of them, but not all of them. These are all very, very important for stability for your back. These are all part of your posterior chain. Okay. So all these have play a factor when you usually lift heavy objects. So if you're like a weightlifter, just like to work out or whatever activity you like to do, training the kind of posterior chain, which is kind of all the muscles on the backside of your body, going from the base of your head down to your heels, is very, very important. Okay, for that support, posterior chain kind of support. Okay, and especially do them efficiently. And a lot of people do train them. A lot of people forget about them. Everyone just likes to do abs and chest, okay, and bro out all the time. But all these have to act usually together for that stability. And a lot of people have a very, very hard time just engaging some of the muscles. Not saying they can't like use them, but they don't know how to use them. Okay, maybe just from it's a long time of just not using them, being sedentary, due to COVID or whatever reason it is, or just sitting down a long time. But all these muscles have to engage to be very, very efficient for that support of your body. Okay. Next, we'll talk a little bit about the spinal curvature. Okay, so your spine is not straight. Okay, it has this weird kind of S motion going on. Okay, and that curvature is very natural. Okay, for your body. And a lot of ligaments are very important here to help with that spine to stay, or that posture to stay correct. Okay, you see here's your cervical. Okay, 1 through 7, thoracic, T1 through T12, lumbar, L1 through L5, and then you have your pelvic girdle, which is your coxum, your sacrum and your coccyx. All right, so type standing posture. Okay, so excuse me. This is a good slide to kind of break it down, and a lot of these are a little extreme. Some people may have some of these, some people may not. Some people seem very, very, very crazy. Okay, so this is the normal, neutrally balanced spine. Okay, standing posture. Okay, posture is very important because a lot of time, if you don't train your body properly, or you have a lot of tight muscles or weak muscles, your posture can be affected. Or as a lot of like overuse, or just over the years of doing the same thing over and over again, your posture can really change. The biggest one that I see, especially in like college level and high school, and I worked high school, was a lot of lordosis. Okay, so lordosis, you have what's called this kind of anterior tilt of your pelvis. So this is like a rotation forward. As a result, it gives you this extreme lumbar curve. I call it your ghetto booty. Okay, because you stick your butt out really, really far. Okay, as a result, extreme lordosis. Okay, remember your lumbar spine does not like to do a lot of extension. Okay, so you're pushing that to extension. Okay, some of like your like low thoracic kind of shifts anteriorly. Okay, sometimes your head shifts anteriorly. Okay, so you have this really extreme lordotic curvature. Okay. Other things that can affect lordosis is tight hip flexors, tight back, weak abs, and weak kind of glutes and hamstrings. Okay, that is called the lower cross syndrome. Okay, next one is kyphosis. Okay, that is kind of like a forward head, extreme arch back. Then your kind of lumbar spine kind of goes forward. Again, you have that anterior pelvic tilt. And then your kind of like femur bone kind of shifts posteriorly. Okay, that would where they get this really kind of extreme back curvature right here. Okay, and this is natural. Okay, they're standing upright, and this is what it is. Okay, flat back obviously is exactly what it is. Okay, you get this kind of like flat back appearance. Okay, it's a straight back. Okay, you don't have a lot of that cervical spine curvature. Okay, because your head and neck are shifted forward. Okay, you have this posterior tilt of your pelvis. Okay, it goes backwards. Okay, you don't see the posterior tilt too often. Okay, so everything kind of shifts forward. Then there's sway back, which is more your thoracic just kind of shoots back. Okay, similar to kyphosis, but there's the rotation of the hips is different. Okay. To where with kyphosis, you have the anterior tilt of your pelvis, and then sway back, you have the posterior tilt of your pelvis. Okay, which give you more of pretty much no butt. Okay, and her head just forward. And last one, scoliosis. A lot of people do have some kind of mild form of scoliosis, which is some kind of abnormal like side curvature of your spine. Okay, most of the time it's asymptomatic. It can affect other different things, as you can see on your hips right here. They're not quite straight. Okay, as a result, now this right leg is longer. Okay, because of that. Okay, so that can affect some like your running mechanics and give you potentially a higher risk of like hamstring strains, like on this side, just because it's now having to elongate farther than it should, and so forth. Very few times we'll actually do a surgery for scoliosis. I've seen a few. Only because it was pushing on the heart and lungs. That's how far the spine was kind of pushed out. And it was kind of weird. If I find the pictures, I'll try and like put them up here in the future. She sent me like her x-rays, and it was really crazy. She had, I can't remember how many screws, and she had 2 rods kind of put in the side. And she was like 2 inches taller after surgery. And she was excited because she got a whole new wardrobe as a result. 'Cause she was in high school. But her motion was zip. Okay. She did a lot of physical therapy for a lot of like stretches and just trying to get her range of motion back. Okay. She was very, very tight as a result. Okay. So observing kind of like your posture, a common one is called a plumb line. Okay. I see like in the picture here, that kind of like line that goes all the way up and down. Oh. So it's really easy to do is you just hang a kind of string from like the ceiling or something up high, and you put a weight in the bottom. Okay, and just let it dangle. And you have someone stand behind it, and then turn to the side and back and so forth. Excuse me. And then you just kind of see how things change, especially change left to right sides. Okay, so let's go straight down this person, and some things are very subtle. You can see. You see his left shoulder is slightly higher than his right. Okay, you can see it like the nipple line. Okay, one's higher than the next. Okay, if you look from behind, okay, you see maybe he has some scoliosis, comes a little bit out to the side and kind of comes back. His right hip's a little bit higher. Okay, just from where his pants sit. Okay. Usually how you do in the plumb line is with a string, it should be like right behind the ear. Okay. Then it should come and hit the tip of the shoulder. Okay, which is his back a little bit. But he's also probably really focusing on this. Then it comes, where's my pointer? Back just behind the kneecap, and then hits the lateral malleolus. Okay. And that's generally where it should be. Not everyone's going to be perfect, and that's fine. But kind of help you identify the different kind of asymmetrical issues. Another thing they'll use is they'll use a grid. So they have this kind of a door-ish that you can see through. And it looks, let's say it's this kind of like wooden frame here. And there's a bunch of lines that kind of go up and down it. Okay, inside to side to make this grid. So they stand behind it, just like kind of like the plumb line, and that gives you more lines to kind of compare different things. So it's really good if you're trying to kind of identify one thing versus the other, especially if you're looking for asymmetrical issues. Okay, well, some will come as a result of just kind of overdevelopment, like sport related. For example, that could be a pitcher. Okay, so their throwing arm is obviously going to be more developed than their non-throwing arm. Okay, same with tennis and softball and all those. Okay, usually that one side is going to be more dominant, and you can see the differences going all the way to the back, even down to the leg sometimes. Oh, here's what I talked about already. So okay, middle ear. Okay. Then hits middle shoulder, then greater trochanter in the hip. Okay, I forgot about that one earlier. Okay, and then back patella, then front of the malleolus. Okay, so obviously he's not perfect in this picture. No one will be. That is the view. Okay, anterior posterior view, same thing. Shoulders, okay, nipple line. ASI is the anterior superior iliac spine. Okay, that kind of like your hips. Okay, look at the hands. Patellas, that's another one. You'll see a lot of different issues. You can see patellas should be facing straight ahead. A lot of people, they'll face out or they'll actually point inward. Okay. And then feet position. And then from back, okay, obviously shoulders again, where the scapulas lie. Elbows, okay. The posterior dimples, okay. That's your posterior superior iliac spine. Okay. Your hands again. Popliteal fossa, that's the back of the knee, and then your feet positions. Okay. You also identify where are the Achilles tendons. How are those? Okay, are they even? Are they not? That could tell you different things about maybe which like dominance in the leg, and are they more kind of like the medial head of the gastroc dominant versus the lateral and so forth. And that is the spine.